Good afternoon, everyone. It's nice having us here on this webinar of the Yaba Voice of the Federal Neuropsychiatric Hospital, Yaba, Lagos. Today, we are looking at something very important. I know it might vary so much, but that is just to emphasize the importance of what we're looking at this afternoon. We're looking at rape, implications and intervention, and it promises to be a very wonderful time as we look at some of the issues pertaining to this special discussion that we'll be having today. To welcome us formally to this webinar is the Medical Director and the Chief Host of the Federal Neuropsychiatric Hospital and of Yaba Voice, Dr. O.C. Ogun. You're welcome, ma.
Good afternoon, ladies and gentlemen, from across many spaces all over the world. Today's topic is another interesting one: rape, implications, and intervention. Now, when we talk about rape, the rape itself has reared its ugly edge, and it has become another battle that we all have to fight on all fronts. The word rape, it's on itself connotes violence, a word that originated from the Latin word rapere, which means to grab, to snatch, and to carry off. Yorubas have a word for it, ìfipábánilòpọ̀. That in itself connotes violence. The Igbos, the Hausas, their descriptions too connotes violence. The rapist snatches or seizes the victim in a rude manner without giving excuses. He grabs, seizes his victim suddenly and roughly, and carries the victim up to a wall that the victim would not have wished his or her worst enemy. Rape. Have you seen a victim of rape? Or have you been raped before? I had a clinical experience of one. As a house officer, when a mother brought a 3-month-old girl child and accused her husband of raping her. I've seen many, but that's one has always stood in my mind. In the last few years, and more so, during the lockdown and post-lockdown of COVID-19, the word rape is in our consciousness daily. Hardly does a day pass without a major newspaper writing about it. Themes such as father impregnates a 13-year-old daughter, 87-year-old woman raped by 2 armed robbers. I wonder what they were looking for. Teacher defies 15-year-old pupil sitting whilst 4-year-old defiled by a security guard. In the political and legal arena, interventions are being considered. For example, Minister of Women Affairs, Pauline Tallinn, advocated death penalty for rapists. Many state governors are waking up to their responsibilities about problems being caused by rapists, and laws are being enacted. The Lagos State House of Assembly has called for strict implementation of rape laws. These are headlines in our newspapers. And this week, the governor of Kaduna State, Nasir El-Rufai, signed the State Penal Code Amendment Law 2020 on rape. Edo State has opened a sexual offenders register and state sexual assault referral center. And so many state governors are coming on board. Now, when we talk about rape, sometimes people think it's only the victims are girls or women. No. Males are not left alone. They too are intentional raped by fellow males. Female perpetrators have been reported. house girls, house boys have been known to turn to rape the children they are looking after, thus sexualizing these children. There have been reports of those who are raped at the correctional centers, at IDP camps, while women and men have been raped by their kidnappers. Another trend these few years is the occultic practice of wiping up the victims with white handkerchiefs. This has reportedly been done by Yahoo Plus boys and ritualists. To do justice to the topic, rape, implications, and interventions are two of our mental health professionals. The first person, Dr. Ijarugbe Temitayo Grace, is a chief consultant psychiatrist. She's a child and adolescent mental health specialist of this great institution. And she's actually the head of the unit of a child and adolescent mental health services center. She's a trainer of universal treatment curriculum of the drug advisory program of the Colombo Plan, sponsored by the United States of America. She has over 20 years working experience in the field of psychiatry at the Federal Neuropsychiatric Hospital, Yaba. And she's a fellow of the National Postgraduate Medical College of Nigeria. The other professional is Mr. Ajayi Ayodeji, who is a chief clinical psychologist with psychology department of this same hospital. He has been involved in managing patients with psychiatric illness in the hospital using various psychological interventions and assessments for over 11 years. He was also involved in various psychological emergency rescue operations, notable among which are the psychosocial response of the Dana Air crash survivors, Ebola response team, and currently the COVID-19 psychosocial response team. Ladies and gentlemen, please settle down and listen to our experts talk to you on the topic rape, implications, and interventions, while I hand you over to our moderator, Mrs. Kemi Akintoyeshi. Thank you all.
Thank you so much, the medical director and the chief host of this webinar. You know, if you had always been joining us, that you would wet the ground so much more that you would have a lot of appetite to take more in. And now she has introduced the speakers today who would do justice to this topic of discussion, rape, implications, and intervention. Please note that we're also streaming live on Facebook, so you can also connect with us on Facebook if you're not able to log in here through Zoom, or you can also send the message across to people. The questions and comments also should be sent to the chat box. So we'll go straight into the discussion, and I will hand over to Dr. Grace Ijarugbe, who is going to start off this discussion today, rape, implications, and intervention.
Ladies and gentlemen, thank you all for logging in from all over the world. My name is Grace Ijarugbe, and this afternoon I'll be speaking to you on rape, the different dimensions of rape as a situation, and also how common rape is in our environment. Let me define rape. Rape is sexual assault. It's penetration, intercourse, or other forms of sexual activity, but it is important that there would be penetration by any of the sexual organs. Now, also, if there's penetration of the mouth, what they call oral sex, by any body part or any sexual organ, that is also rape. Rape is unlawful, and it's unlawful sexual intercourse. Mouth can be involved, the anus can be involved, and the genitalia, what we call the sexual organs, can also be involved. Now, I want to give you the different context of rape, because when you talk about rape, people always gape their mouth open and say, was that rape? That wasn't rape, that was just an affair. There are different contexts of rape. Rape is illegal, it's unlawful, remember that. And any of this context of activity will constitute as rape. So if there's non-consenting sex, if a partner in that sexual activity is non-consenting, it is rape. Whether it's a spouse or a stranger or friend or an associate. As long as one partner in that sexual activity is not consenting, that is rape. If there is an attempt to mentally subdue an individual in order to get them to participate in sexual activity, that is rape. These days, we begin to have a lot of rape cases, especially what we call date rape, where two people go out to enjoy an evening out, and one of them is given something to drink without his or her knowledge. And consequent after that, the other party has sexual intercourse with that individual. That is rape, because that person was deliberately mentally subdued. If the person was given too much alcohol to drink and sexual activity occurred after that, that is also rape. Another context of rape is consenting underage. So anybody who has sex under the age of 18, that is rape. If a girl goes out to deliberately lure a grown-up man, and the girl is 16 years old, and the man has sex with that girl, that is rape. That girl has statutorily raped that girl. Okay, even though it was the girl that consented or even lured or even enticed him to have that sexual activity. When rape is perpetrated by minor, these days we see 14-year-old boys going to rape 10-year-old girls, or older girls, 16-year-old girls, raping 10-year-old boys. Okay, so there can be sexual activity between two underage people in which one party is coerced, is physically coerced, forced into that sexual activity. There are people we call emancipated adolescents. They are older adolescents, but they are still underage under the law. They are 16, 17-year-olds, and they say they are dating, and they're going out, and they're having fun, and they're having sex. And both of them are consenting. They see nothing in it, okay? But under the law, that is still rape, because statutorily, both of them are underage for that sexual activity. Now, people who have what we call no mental age, they are individuals who are mentally disabled, who do not have capacity to take decision or recognize the consequence of participating in sexual activity. And some other individual who is mentally capable, having sex with this individual, is also raping that individual, okay? Because that individual does not have the mental capacity to give consent for that sexual activity. So it's not surprising that we see different types of activities that shock us these days when we talk about rape. It's also important when we are looking at these different contexts of rape that we begin to talk to our boys, okay, and we begin to talk to our girls, because many at times, most of them do not know these different contexts under which a sexual activity can be termed as rape. So what is rape? Rape is victim versus the perpetrator, where the perpetrator is the person who has enjoyed the sexual activity and the victim is the one that has been coerced into that activity. It's a situation where there is a more vulnerable party and a more privileged one, okay? In terms of physical strength, where the perpetrator has more physical strength or has more mental capacity or has a higher social status or has what we call weaponry. So in the context for rape to occur, somebody has more physical strength or has a higher mental capacity or has a higher social status or has what we call weaponry. What I mean weaponry is that this other individual does not want to consent, but because this party brings out a weapon, he or she begins to remove her clothes and lies down and allows sexual activity to occur. That is not consent. That is coercion, okay? So because of the power of that weaponry, this other individual is forced to consent to that sexual activity. We see rape in several of our cultural and social contexts in daily living. And we must begin to be aware of these different contexts, because sometimes family members engage in this, people that are our loved ones engage in it, and they do not see it as breaching the law. If at an early age, an underage child is given out in the so-called social activity of marriage, and the person that he or she is married to has sexual intercourse with her, that is rape. Even though they have performed all the traditional ceremony and all that to say they have given her in marriage. Under the law, it is rape for this man to have sexual activity with this girl. Okay, so we are beginning to look at our different social and cultural contexts under which we as a community can perpetuate rape, can encourage rape to occur. Where in our context, maybe under religious context, we see that a woman has got to submit to her spouse, or other way around and all that. And this partner takes advantage where this other spouse has not agreed or consented to this sexual activity and performs the sexual activity against his or her will. That is a social context of rape. These days, we are beginning to have initiations and rituals in which part of the activity is actually rape. Okay, so they'll bring this person either in the university or who is underage, and it's like, for you to be initiated into this step of life, you have got to perform this sexual activity. Okay, so they bring in one man or one woman or something to have sexual activity with this individual, and that is rape. Okay, but it's occurring in the context of a ritual. They are having rituals done and they are having sexual activity. Where parental consent is given for another individual to have sex with their children, it is rape. These days, we are having what you call sexual slavery. And we know some cultures where they keep what you call harem. They bring in these girls, these women, who really do not want to have sex, but who are owing to these people who are financially overlord over their caregivers. And they keep them in harems and have sexual activity with them. All right, we are looking at other social contexts apart from the harem context. Okay, and we're looking at situations where the individual or the community gives out a girl as a gift, okay, as a sexual gift to a man, because they are owing the man or because they are trying to coddle favor from that man. That is rape. All right, either for repayment for loan, or sometimes what we call spoils of war. We have women or individuals captured and taken away in captivity, and they are used for sexual exploits because they are seen as spoils of war. Sexual engagement over the internet is also becoming more prevalent these days. So what is the breaking news that we have? All right, there's public outrage when a senator takes a 13-year-old as a bride and he thinks this is right. There's also public outrage when individuals are seen to have raped a student, maybe a teacher or somebody in the community, as earlier described. A song that will not go away is Bring Back Our Girls, because today we still have so many girls out there in captivity who are being raped daily. I want to talk about how common rape is. It's all very, very difficult to put together. And why? Because many people do not want to report rape. Many people who are perpetrators of rape are people that are known by the victim. They're either uncles or parents or teachers or somebody in the community that they do not expect to perpetuate this. And therefore, there's a lot of hush-hush and silence over a rape activity, okay? Either the child or the individual who was raped, the victim, does not want to talk because of stigma and embarrassment, or the community who have discovered this rape action also do not want to bring it to fore because of the individual who was involved, perpetrator, the person of the perpetrator who has perpetrated that rape, or because they do not want to stigmatize their family or their person or their child who was raped. Okay, so we have underreporting when it comes to the cases of rape. We have incidences when people even go to the law enforcement agencies to report rape, and they are told to go back home and settle it, okay, and not bring it to the attention of the law. So rape is something that is so underreported, but we have so many incidents we have so many reports that have emanated from different regions to tell us how common rape is. We know that in many studies that have been done, about 30% of boys and girls, males and females in the community, have been raped in the past, okay? 25% of hawkers, 38% in different countries, 22% of female students in the north. So many studies that have been done. But of many of the studies that have been done, only about 18% of cases have been said to have been reported to law enforcement agencies. And we do not know why. I want to bring a case to attention before I pass it on to the next speaker. A child who is mentally disabled in the community attains the age of about 16, 17 years old, and the parents decide to marry her off because they see that, you know, because she's mentally challenged, she might not be able to achieve marriage on her own. Okay, I want you to think of that context and see whether this child, this 16-year-old mentally disabled child who has been given up in marriage to a family, has been defiled in the context of rape. Thank you very much. I'll now pass on the activity to the next speaker. Thank you for logging in.
Thank you so much, Dr. Ijarube. She had given us a definition of rape. Beyond giving us that definition, there's a fact that they are also giving us just different types. You know, sometimes something's happened, a man says, oh, I paid the bride price, and so it's not rape. But then it's actually rape as long there is no consent, as long as you're using force. Those are the operational words, and that's what had been broken down for us today. So when there is no consent, then automatically it means that is rape. So let's begin to look at the definitions and every other thing that had been cleared today. That would help us to be able to understand better as we move on. All right, so we're going to go over to Mr. Ajayi, who is also going to share his view on rape, implications and intervention. But please note, the questions and comments should be sent to the chat box, and we will take them as we go on in this discussion. Thank you.
Once again, we want to welcome all our viewers all around the world for this all-important discourse. We're talking about the issue of rape. I'll be handling the issue of the risk factor, the causes, then the implications and the interventions, just in a quick succession. One of the things we need to know about rape is that those that have been apprehended, they have a specific nature. There are some characteriology according to our research. And some of the things that have been found, because when information is sought, then people can go be reformed. When people are not informed, they will be deformed. And because of that, we need to know some specific features of these rapists. From our research, we found out that most of them are gang members. So most of these are red flags that each and every one of us need to know. And our girls also need to know all this. Gang members are actually, they are prone to become rapists. Then people who are using illicit or harmful drugs, especially alcohol, has been implicated. It's highly correlated with issue of rape. Most rape action has been found to be that, okay, most of the rapists have used alcohol in the past. Then antisocial personality disorder is actually very, very correlated. For those of us who are in the psychological world, we know what antisocial personality disorder is all about. When people are they are rebellious and they always they are against the societal norms. Then, a lot of children who have been exposed to interparental violence, all those ones are also they are categorized as children that are high risk. So these are all these are red flags that we need to really find out. That history of physical or sexual abuse as a child is also very, very important. Then people who have limited education, either male or female, they can either be rapists or they could be subject to the rape. Then acceptance of violence in some environments. The issue of violence is actually accepted. Like people who live in some part of the country or part of the states, you find out that people who live in areas like AJ, they are more prone to violence. A lot of them learn to cope with life through violence. Then issue of multiple partners. When the people are involved in those kind of activities, multiple partner infidelity, then they could also be rapists. That issue of gender inequality. When people believe that, oh, there's a superiority of a gender over the other, then they could also be involved in rape. So let's look at the community and the societal issues. Most of these has to do with the belief that condone violence, especially when it comes to the society and the culture. A lot of such culture believe that, oh, the male superiority, then a lot of them believe that the females are there just to keep the men's sexual urges at bay. So once you have a sexual urge, you can always discharge it when you have a female around. So as far as those society is concerned, that's not a problem. And a lot of people also believe in that rape is actually a sign of masculinity. You can actually take charge of the woman once you're a male. All these are beliefs that are archaic, and they're actually very, very akin to this issue that we're talking about. Then the issue of a weak community and legal sanctions. I've seen a situation where a man actually raped his wife's sister, and they went to the village community to discuss the issue. And they said the woman actually violated the man because it's a red tap sheep, and because of that, she has to do some sacrifice for violating the man, for exposing him unwittingly. And you ask yourself, who is the victim? Who is the victim in this case? So all those issues are very, very germane. Let's look at some specific causes in Nigeria. When we look at exposure to modernity, a lot of our children now, they spend time on their laptop. Long were those days when people go to cinema houses to watch pornography. But now, right on your phone, your iPad, you can have a lot of exposure. Then the kind of books we read, you find out that most of our videos they are laden with sexual themes. And because of this, a lot of our children they are highly sexualized. So all this, most of them want to actually practice what they've been seeing and what they've been hearing. Then the issue of mishandling rape cases, the way the rape cases have been handled in Nigeria, you find out that most of the legal system, what they do is they treat the issues like, they treat the offenders like the victim. A lot of times they ask for a lot of evidences. Those evidences can actually ridicule and shame the victim. And a lot of them, the issue of peer pressure is also very important, and influence. A lot of people do what their friends do. And because of that, some of them are actually initiated into the issue of rape through friends. Then it's about sex. A study was done where some people believe that HIV could actually be cured by what? By having sex by having sex with a virgin. And because of that, you find out that they put those kind of virgin into a lot of compromising situations. Then the issue of rape and stigmatization. The issue of stigma in Nigeria is actually a very major problem. Most of them that are raped, they don't want to come into the fore. They don't even want to come into the limelight because of the way the same issue is handled. Then the issue of adolescents are actually very explorative. They want to try anything out. And because of the high libido, most of them can actually go into all this. The issue of rape and the constitution, a lot of things need to be amended, especially when it has to do with the penal code, as in the description of rape and some other issues. Then parental upbringing is a very important factor here. Then the problem of reporting, we talked about that. Then poverty and economy. A lot of people could sell their children just for 5,000. They could allow their children to be raped because of some immaterial issues. Then declining moral values. You agree with me that the moral values in Nigeria is actually coming to a brink because of a lot of factors. And let's look at the health implications of this rape. What are the things that happen to these people? When we talk about their reproductive health, we have gynecological trauma, unintended pregnancy, unsafe abortion. Because of this, some people need to commit abortion because of it. I've seen a case when I was a teacher in secondary school. One of my students was actually raped, and eventually the parents have to commit abortion for a girl of just 3. And that was quite traumatic for the girl, and for some of us who heard about it. Then sexually transmitted infection. There was a case of a 62-year-old man who raped an 8-year-old girl and eventually infected her with HIV/AIDS. This is actually traumatic for the child and for everybody around. Then traumatic fistula and even anal fistula for the men. You find out that a lot of them have a lot of tears in the process. Some of the males have their anal fistula open, and because of that, they have to be operated upon. Then mental health issues are not left out of this. We have depression, post-traumatic stress disorder. Some of them have flashbacks. Some of them have anxiety disorder. Some of them have sleep difficulties because waking up to this reality makes them feel really, really detached from themselves. And some have somatic complaints all over their body, and some of them even have suicidal behavior. Some of them want to kill themselves because of this. I see themselves as dirty, as someone that is used as a pack of trash. So the issue of panic disorder is also very, very important here. Let's look at some of the behavioral issues that come up. You find out that people who have also been raped, they are prone to high-risk behavior, such as unprotected sex. They eventually, I've seen a 6-year-old girl who was initiated to sex because the mother was not there. And you find out that at a point in time, she became so promiscuous, anything anybody. Then early consensual sex initiation, then multiple partners, just like this girl. Then a lot of people also, they want to manage the case by coping with alcohol and substance. A lot of them begin to use different kinds of substances, which are also high risk behavior. Other high risk of perpetration is also seen in men. People who have been raped before can also be rapists, and people who have been raped as females also they become serial rapists, or they become susceptible to serial rape. Eventually, after the first rape, they just give in to several other. Let's look at the fatal outcomes. Some of them are deaths. Most of the deaths come from suicide, pregnancy complications, unsafe abortion. Some of the abortions are not properly done. And because they have to keep a lot of things hush, hush. Then the issue of AIDS, eventually they develop the AIDS. Then murder, some of them even kill themselves. They do honor killing. They kill themselves or kill the perpetrators. Then infanticide of the child. When a child is born out of rape, sometimes people looking at the child reminds of the old incident. So you want to just kill the child. So all this has been reported. Let's look at some of the psychological effects on the victims. The issue of hopelessness, waking up to that is this me? Why did I become subjected to this? Then despair, powerlessness, and loss of control. Flashbacks, they keep having a flashback of the incidents. Then they stop sleep because of that. Then denial, sometimes they feel that this is not true. Then because of that, they live in guilt. They start living in guilt and looking at it that maybe I was the cause of all this problem. Then fear emphasis, they become fearful, they become trembling. Then shame is very important. Then numbness, mood swings, anger, anxiety, and helplessness. These are some of the psychological issues. So, but maybe later we'll talk about the issue of the intervention, because the intervention has to start with the first aid. The first aid may be a psychological first aid. Then, more importantly, some of them have tears that have to be sutured through surgery, and other medical legal issues have to be taken care of. Thank you very much.
Thank you so much, Mr. Jai, for that in-depth view that you had given us about why people would commit rape, and more importantly, about some of the psychological issues the survivors now, we don't call them victims again, survivors actually go through. A lot of people blank out, the sense of guilt, the feelings that there is something actually wrong with me. There are things that are real, the survivors had to go through. And they're not just imagined, they are very, very real situations that they have to contend with. And one of the greatest things that had also aided rape, sexual assault, child abuse, and every other thing in our environment is this code of silence. Usually, don't talk about it. There is an hush thing about it. How can we break this? How can we give people access to begin to come out and talk about their experiences without naturally stigmatizing them or making them to feel bad? When people talk about it, usually everybody start looking at them as there's something wrong with this individual. Dr. Ijarigwe, how can we break this code of silence that people are pushed into when they have these experiences? Thank you, ma'am.
Okay, thank you for that question. The hush-hush thing is due to stigma. The people who survive these terrible incidents are stigmatized, their families are stigmatized. The prospect for marriage in the future or alliance with other people seem to be compromised or limited. And because of that, everybody says the damage has been done. Let's not do further damage, okay? But there are certain people that we know are vulnerable groups. When I say vulnerable, I mean people that we know that there's a high likelihood that by the reason of the circumstances of their living, they could have been raped. They might be raped. And so those people could be screened. Let's look at people who are living in IDP camps, people who are migrating from place to place. Maybe their parents are nomads, okay? People who are living with, maybe they are fostered away to go and live with other individuals. People who are very, very beautiful. People who are not so beautiful, not so attractive. Interestingly, people who are on those two extremes have a higher chance of being raped, of being sexually assaulted. Okay, so we can look at these people that, you know, people who are very young, people who are students, who are put into custody of others, people who are in school. We can screen all these individuals anonymously. Let them know that, you know, no matter what you tell us, nobody else will find out. This is, you know, your confidentiality is guaranteed. And if we screen and put out those, you know, instruments for them, instruments are like maybe a paper to fill or something. They'll fill it anonymously, and they'll let us know if they have been raped, when they were raped, who did this. Okay, there are ways that we can, you know, surreptitiously gather data, gather information from people that we think have a high likelihood of being raped. And I think once we begin to do that, and we begin to address the issues. We begin to bring out these individuals for them to be treated. We bring them out for them, to be comforted in quotes, and then we also address the issue of their perpetrators who did this, and they can see these individuals being sanctioned or being punished for what they have done. Then we'll begin to have issues of rape declining, and probably more people coming out to say that they were raped. If, for instance, 4 or 5 or 6 or 7 individuals who previously put down their situation for others to discover. I know now, for right now, even in Lagos State, we have many agencies that address these issues of rape, but they are not getting people coming forward to say this has happened. So if they can surreptitiously get this information to these people, and these people handle these cases, and they see justice being done, more and more people will come out to say that this happened. We also need to have a lot of advocacy in the community, advocacy that tilts the blame from the perpetrator, that tilts the blame away from the victim or the survivors to the perpetrator. Because right now, what we seem to have seems to be more of the stakes balancing in favor of the perpetrator than those who were actually injured. Thank you.
Okay, thank you, Ma. So opportunity and enabling opportunity for people to come out and actually share their story. And for everybody listening to their story, not to judge them. Oftentimes their story may not rhyme. The story might not look like that is a trend. Usually you have questions like, why did you go there? What were you doing there? Didn't you see the signs? Why didn't you shout? And then making the survivors to feel pained the more, to be able to go through lots of other psychological pains and burden that they have to now carry, plus what had happened to them. Let's create an enabling environment. Let's be more attentive. Let's give them an opportunity to heal. And that's what Dr. Ijarube had said this afternoon. But then again, usually people who have been violated one way or the other, raped, abused, and everything, usually they have this feeling that there is something wrong with me. So a lot of them feel if there was nothing wrong with me, then this shouldn't have actually happened to me. Mr. Ajayi, how can we help people deal with this kind of thought, especially when they had gone through this experience and they are finding it difficult to move forward?
Thank you very much, Kemi, for that very incisive question, because it's actually very important. A lot of people have gone through the issue of rape, and because of that, they won't talk to anybody about it. Unfortunately, for some of them, they've either talked to someone in the past, and the way it was handled. I had a patient who told me that she was serially raped by neighbor, and at a very opportune time, one of her younger sisters was raped, and because of that, she told her mother that this uncle was raping my sister. But unfortunately, the mother shuts them down. That never talk about such things again. Why will you say such things? You want to spoil the family, this and that, and because of that, she shuts down. Unfortunately, she didn't just shut down. Something very important about her shut down too. Her self-esteem was actually dead since that day. Unfortunately, good for her, she was able to internalize it, and she internalized the anger and converted it to academics. She was doing very well academically, but her younger sister was not able to do that. And her younger sister became a product that she had about 4 children for different men along the line. She was actually she was brutalized, she was traumatized along the line, but she converted to academic. Eventually, she saw. We find out that because her self-esteem was affected, it affected the choice of a man, because she saw the only man that loved her as someone that was doing her favor, because she had problem with self-esteem. Despite the fact that she was good academically, she was doing very well. She felt any man that comes around her was doing her favor because she's just a pack of trash. But because she came for eventually we were able to walk her through that step. At a point in time, she took a decision that she was coming out of the marriage because the marriage was becoming very abusive. The man was financially abusing her in every other way. She was making so much money. The man was not doing anything. The man was living off her. So for those kind of people, they need to visit the professional, because you find out that some of them have internalized it. They just like the grieving process. One of the grieving processes is anger. Anger could be internalized or externalized. A lot of them internalize and they tell themselves that, oh, I'm a very bad person. That's why this happened to me. But when they seek professional help, we're able to help them out to understand that, oh, you're just a victim of circumstances. You are not the bad person. And they need to do that. Until that is reinforced in them, some of them eventually they keep going down and find out that they have some bitterness inside of them. Some of them against men generally, or against sex, or against the opposite sex. And if this thing is not, if it's not treated, most of them eventually end up in one abusive marriage or the other, or they end up not even getting married at all. So all these issues are things that needs to be dealt with before that person eventually gets into a marriage. Some of them is not even about marriage alone. You find out that they can't do well in any interpersonal relationship, and that affects their functioning on the job. Some of them, they become very aggressive on the job, and because of that thing that is in their mind, because they are fixated at a point that needs to be resolved. But because it has not been resolved, you find out that they keep acting out. So psychological issues, they have to be resolved. Nothing can be swept under the carpet. If it doesn't come out as psychosis, come out as neurosis. So these issues have to be dealt with. Thank you very much.
All right, thank you so much, Mr. Ajayi. Yes, intervention had to be put in place for people who had been raped so that they can deal with the feelings of self-esteem, self-concept, and whatever it is that they're actually going through. Nothing is wrong with you as a rape survivor. You had gone through something very traumatic. You're pulling through and you're pulling out very, very strong. So nothing is wrong with you. Something is wrong with a rapist, as a matter of fact. Okay, so Dr. Ijarobe, I want to ask that sometimes the sense of closure is what actually helps people to be able to feel that justice had been done, and then they are able to push through. But then how can survivors move on when that sense of closure is not there? Justice has not been given, or they have not been able to achieve justice. The family has decided, let's just cover it up. The police have said, let's go and settle it at home. Sometimes the court, is in the court for so many years, and then the legal system is not even giving you the justice that you want or you demand. How can you have a sense of closure that would help you to be able to move on?
Honestly, it's not even just the survivor, the victims that need that sense of closure. The family, the loved ones of those individuals who have been violated, all of them can go through so much psychological pain, you know, and they can, all the things that Mr. Ajayi talked about as having occurred after rape can occur both in those victims and in their family members. So the family members, the significant others, and those survivors, all of them need to have closure. Supposing closure does not occur, and for one reason or the other, justice has been perverted or has failed to be done, the victim can still go on, the survivor can still go on. And so everybody out there who has been raped before or who is a survivor needs to know. First is that you have to look at the situation exactly the way it is. You are not to blame. You are not the one that did this. It is not your fault. Rather, you have gone through an incident that has traumatized you, and you need to come to terms with it. Number two, you need to recognize that you are in pain. Many people bury their pain in different ways, either by denial, they say it's not there, or they say they are not affected, or they say, and so they don't seek professional help. You must try and seek professional help. Look for somebody who has been trained in, helping people who have gone through this kind of incidents, and go in for some form of counseling or therapy. Family members too who are in pain should do this. Family members should not leave themselves and say, no, it's my daughter that this happened to them. I don't have issues, okay? Family members that need succor, that need support, should also feel brave enough to ask for it. They should go in and ask for it. Number three, have a sense to move on. Have the will, the drive to know that you have the capacity to move on, to drive on through this. Try not to be stuck on the problem. Stuck on the problem means that all you now focus on is the problem, the rape, the incident, the place, the people, the person, the consequences. And that is all one is living around. Try to move on to other issues that you have in your life. Try to look at family, look at your friends, look at your career, look at those desires that you have in terms of furthering your goals, your ambitions in life, and have a drive to move on with them, okay? So be less problem focused and be more problem solving, okay? So look at how you can solve these problems. If the person suddenly stops sleeping or is not able to fall asleep at night, look for a professional that will help you resolve this problem of not sleeping. If, for instance, there are anger issues and the person is becoming more angry than usual, look for a professional that will help you resolve your anger issues. If, for instance, the academic is suffering or the work is suffering, look for people who can help you get on with the spirit of work again, help you learn how to learn again, okay? Try to move on with life. Try not to stay focused. Sometimes there's this blaming thing. There's this anger thing. There's this vengeance that people want to go back for. Some people spend their entire life planning how to avenge the perpetrator. And that not only puts them back into, they could now become the criminal and go to jail, okay? So they must learn not to take that vengeful path, but rather move on, report, do everything that they need to do, and move on in life. Thank you very much.
Thank you so much, Dr. Ijaribe. What you had told us now is sometimes closure might not come through all the means that we want it to come through, but you as an individual will have to come to terms with your experience, seek help, and then you can move on. All right, so you can also give yourself the liberty to be able to push through as much as possible. All right, so Mr. Ajayi, what safeguarding measures are in place in Nigeria that could encourage both historical and also current disclosure? What are those things that would help people? Are there measures in place now in this nation that will help people to come out more and share their story and talk about things that have happened to them?
Thank you very much, Kemi. These issues are very, very important because just like we said earlier on, people need closure. And because they need closure, they need a safe haven, somewhere where they can actually bear their mind. They need people that they can talk to that in a non-judgmental fashion. But you find out that a lot of them the first place they present in is the police station. And what happens? You find out that a lot of the quizzing, in fact, from a lot of literatures, it's as if the policemen see them as the victim rather than as the victim, rather than the perpetrators rather than the victim. So what they need is a safe haven. Lagos State has actually done a very good one. That's the Mirabel Female Center, where people can go and see counselors in a non-judgmental environment where their questions are asked. They are clinically interviewed. They get to the root of it. Is it actually someone that is malingering or someone that is actually going through the process? So we have such centers in the state. But the others have been treated as a criminal through the criminal justice system. But what we need more is the public health system, where awareness needs to be done. A lot of awareness right from the primary school, because you find out that most of these things that I saw a question here that what kind of therapy will a perpetrator go through? Most of these things more of a cognitive thing. Some of them are fixated in their mindset, and some of them are behavioral issues, right? Maybe while growing up, some of them are fixated, and this thing needs to be changed. Either through cognitive behavioral therapy or whatever. So some of them, those belief systems need to be changed. And one of the ways to change those belief systems is very early at maybe primary school. Sex education should be inculcated. Let them know that going and touching anybody without their consent is a criminal. Let them know from that. Then the community too. We need to re-educate our people, reorientate our people, rather than allowing the community to go on with the belief that things can be done and be swept under the carpet. Nothing can be done and be swept under the carpet. Then the other issue is the legal issue that needs to be, the legal reform that needs to be done, because you find out that the legal system does not give room for enough resolution of rape cases. So the legal reform has to be done. A lot of states are doing that. The MD talked about the Ekiti states and the Kaduna states. That is quite novel. We need more of that in our system. Thank you very much.
All right, thank you so much, Dr. Ajayi. Dr. Ajayi, can we say all perpetrators have mental disorder? Is it safe to agree that all of them have mental issues? And then how can we now get community to report cases of rape or see it more as a serious issue? Dr. Ajayi, please, over to you.
Okay, so not all perpetrators have mental issues. In short, only very, very little percentage, maybe 1% of perpetrators would clinically be diagnosed as having mental illness. Many of the perpetrators are sane individuals. There are people who do not have mental health issues. Well, they could have mental health issues, but not mental sickness, not mental health disorder the way we know it as sickness. And so what is wrong with many of the perpetrators is that in growing up, they have not been adequately shaped. They have not been brought up properly. Their mental states, their mental interests in the opposite sex or in sexuality, their orientation may be warped. It may not be the normal kind of orientation. And this is very important in bringing up the boys in this generation, okay? So because many parents will say, oh, somebody raped my child. But how are you bringing up your boy? Many people say, oh, somebody raped my, how are you bringing up your girl in terms of sexuality? How many people are talking to their children on how to handle their sexual urges? We had this social media, I don't know whether it was a joke or something, where a girl was being beaten for writing a letter, a love letter to a teacher. And my own take on it was that whoever taught this girl anything on sexuality, a child that is 13 years old can have sexual urges, can have sexual interest, can be attracted to the opposite sex, to same sex, can be attracted to, sexual things, sexual, interest. So how have we educated our children as we were growing up? What did we tell them when you begin to, what they call fall in love with somebody in your classroom? What do you do about it? When you feel like, massaging another girl's breast in the class, what do you do? How do you handle yourself? Are we talking specifically with the children, with the young people? Because many people have escaped the stage, they have grown up, they've gone through the time that intervention could be done, and they are now adults, they do not even know how to handle their urges. They've been told that you can do anything, as long as you can sweep it under the carpet and you're not caught. The only person who is a criminal is the one that is caught. We need to change the orientation of young people who are growing up so that we can have people who grow up sexually, mentally healthy. They have sex, they have healthy sexual interests. They know how to handle their sexual urges. So not everybody who is a perpetrator is mentally ill. In short, only a few percentage are. But we have a lot of men, a lot of women, a lot of perpetrators who have mental issues, okay, who are not totally mentally healthy when it comes to sexuality.
All right, thank you so much, Dr. Ijarube. She had been able to tell us that it's not just everybody that have mental issues or that abuse or rape that has mental issues like that. But then we will now begin to look at Mr. Ajayi. I want you to look at this. Okay, Dr. Ijarube. Olori Ajayi, thank you for this. But then, is there any advice or therapy for people who are thinking of raping others now? Yeah, perhaps someone might be listening to all that we're talking about. Maybe they have this increased libido that they find themselves just wanting to have sex and things like that. What can they do? How can we help them?
Yes, so people who are contemplating rape right now, I want them to realize that it is wrong. First, they have to come to the realization that whatever they are contemplating, this is wrong. This is socially wrong. This is legally wrong. And so they cannot go through with it. But they have emotions they are having to deal with. They have urges. They have this sexual libido like we talked about. They can talk to someone. We have many counselors seated in many places, in schools and institutions, in mental health, in government hospitals, like a mental health facility like this. Okay, so, and there are also so many people, well, there are many people out there also who are not really trained, who are just, speakers, so to say, who are online. Be very careful because they may do you more damage. Talk to a professional, okay? Go outright there and don't feel ashamed. This is something that you are having to deal with. Talk to a professional, because when you're talking to a professional, you know that your confidentiality is guaranteed. Tell them exactly how you feel. And so they'll be able to help you in terms of coming to terms with your own expression of your sexuality. They'll be able to help you with coming to terms with how to deal with your urges and your libido when it comes on. They'll be able to help you with your orientation in terms of sexuality, okay? And they'll also be able to educate you on the different activities that you can do, the different steps that you can take, that you can go wrong in terms of addressing your sexual urges, okay? And so they'll be able to put you right. It's not likely to be a one-time meeting. It's likely to be maybe a series of meetings that they will have with you, and they will talk with you, and they will, from henceforth, you now know how to handle yourself. Sexual urges are part of us. Sexual libidos are part of us. All of us have this, and we must know how to responsibly, in a responsible way, express our sexual urges and libidos without hurting other people that are around us. Thank you.
All right, thank you, Dr. Ijarigbe. Mr. Ajayi, somebody is concerned that when there are issues of rape in the family, is it possible, there is this Yoruba saying that we cannot go to court and then become a friend, and then come back and now become friends again. So when it happens in the family, Dr. Jarigbe, when it happens in the family, how do we handle this? When it's maybe your cousin, your uncle, somebody in the family that actually did this, how can we mediate? How can we help them deal with it?
So we find that rape incidents occurring within family are the most concealed. And why? Why do they conceal it? Because the family is embarrassed, the family is ashamed. And two, because the family does not want the perpetrator to take consequences for their action. They are thinking that the perpetrator going to jail or taking consequences for their action will be more damage to the family. And therefore, there's a lot of concealment within the family. So how do families handle this? How will they, go ahead and resolve this within the family? First, the family must know that there is a victim to consider, the person who has been defiled, okay? And that the perpetrator has done this and has also committed crime. So first, the family might need also to they need to report, they need to do the right thing. And the right thing is to report the perpetrator. But they should not stop there. The family and the victim or the survivor need to be in therapy. They will need to see professionals to seek therapy with them. Okay, because they are also going to go through a lot of psychological trauma in terms of resolving this. But I need to tell you practically, what we have seen happen in the community is that the community will not want, sure, those are the cases that the police will tell them, this is a family matter, please go home and go and resolve, okay? But can the family resolve this? First, the family should come out to professionals. And from coming out to the professionals, and the professionals helping them to unravel what is the boundary for the family, what is the boundary for the perpetrator, and what do we do to help the victim or the survivor. It is from there that there will be a possibility that the family will be able to have the mental strength, the mental capability to be able to go ahead to report to the right quarters so that they can have justice done for the victim. They can take on justice for the victim. So if the family cannot resolve, they should kindly go ahead and see the professionals. Let them go first straight to the professionals and say, this has happened within our family. What should we do? What can we do about it? Okay? And the family will be, the professionals will be able to advise them on what to do. Thank you.
All right, thank you so much, Dr. Ijarigbe. Somebody was asking here, what can the government do? As much as they can do, the organizations that the government have put in place, the helping people who are on the street, who had been sexually violated one way or the other. There are vagrants who are virtually every day being assaulted one way or the other. All of these are, yes, being put in place by the government, the Mirabel Shelter. There are so many organizations that are also helping. Yes, they are helping stand to end rape, and quite a lot of organizations are really working to put an end to all of those things. And so please let us just join first together. Remember importantly that it is not the fault of the survivor. The survivor is strong. He or she had gone through something really traumatic, and what they need from us is our consideration, is our understanding, is our love, is our care. And please let's note that if they don't want to talk about their experience at that time, it's okay. Leave them alone. Let them feel very comfortable to open up, to talk to you about it. And when they are comfortable, they would really open up to be able to talk about it. So I want to appreciate everyone for being here on this program today. We are sorry the network had been fluctuating up and down. It's not our fault, but we'll see what we can do subsequently to improve on all of those things. We know it's the new normal, and then we have to adjust accordingly to all of this. So we sincerely apologize for the fluctuation in network and all things like that. So for those who are not able to join us, this would be sent to the YouTube page of Yaba Voice. Just check on YouTube. We're there, Yaba Voice FMPHY. Yaba Voice FMPHY, and so you can watch this episode as well as previous episodes of what we had done in the past too. So please feel free to also watch, share, and talk about it. We have sent we are on Facebook, we're on Twitter, we are on Instagram, and so please, we would appreciate comments from every one of us. Thank you, Olufumi. Thank you. He said network has been good here. Some people had reported that it's not been good on their end. It's like it's fluctuating all over. But we appreciate you for being here. Thank you so much. We look forward to seeing you in the next 2 weeks, where we'll be looking at post-COVID school resumption, elevating the anxiety. If you begin to touch the pulse of some people now, what is it about resumption? There's so much fear, so much anxiety going on. How will those children cope? How will those children deal? It's a reality that we must confront and deal with. And so we're open to talking about it in the next 2 weeks to see how we can help ourselves as parents and then the children to be able to deal well with all of those things. Thank you so much. So on behalf of the medical director, I want to say thank you for being part of this webinar once again. We love and appreciate you for always joining up with us. Please, like I said, feel free to share, like our page, send to everyone that will benefit from all of this. Until we come your way again next time, thank you so much. Please stay safe and stay blessed. God bless you. Thank you, everyone.
Pam, 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 pam.